Hello, my name is Albert Dowrey. I'm a pharmacist at Injured Workers Pharmacy, and today I'm here to discuss with you some of the COVID-19 information that's become available and answer some questions that you may have. The COVID-19 vaccine is an immunization that prepares a patient's body to fight off the COVID-19 infection. It does take a few weeks for the full vaccination to be effective. So during the time in which after you receive the vaccine, you want to continue to practice social distancing measures until about 2 weeks following your last dose, if it's a 2-dose series, or 2 weeks after the 1 dose if it is the other Johnson & Johnson vaccine. Yes, the COVID-19 vaccine is free. Regardless of which manufacturer a patient receives, the vaccination is free. It also is free depending on whether you have Medicare, Medicaid, private insurance, or you're uninsured. There is no cost incurred on the patient. The eligibility for patients to receive the COVID-19 vaccine depends on the state in which you reside. The schedule for prioritization of immunization continues to change, so we recommend that you check your state's health department website frequently or reach out to them directly at their given phone number. This way you can provide the most up-to-date information and stay available for when the time comes for you to be able to qualify to receive the vaccine. Will the COVID-19 vaccine interfere with any of the medications you are taking? For most patients, no. If you're taking simple maintenance medications for high blood pressure, things of that nature, there should be no impact with the COVID-19 vaccine. The only patients that would want to confirm with their physician prior to taking are if you are on an immunosuppressant cancer treatment, on some sort of immunosuppressant for organ transplant, or you have a history of allergic reactions to vaccines. Those are the only patients that really want to ensure that they have a deep conversation with their prescriber prior to receiving it. We also do, based on our information, see that it's recommended that a patient does not take any pain relievers prior to receiving the vaccine, such as Advil or Tylenol. Those products are fine to take following the receival of the vaccine, but if you were to take them prior, it can sometimes interfere with the ability for the vaccine to function in your body. What are the side effects of the COVID-19 vaccine? The most common side effect of the COVID-19 is arm soreness. Typically, this dissipates after a few days, so 1 to 2 days, you'll start to feel the soreness decrease. The more you move your arm, although it can be tender to move, the more you move your arm, the faster that pain will actually go away. So we do recommend just doing some slight stretches will help to get rid of that soreness. The COVID-19 in some patients is also, we've noticed that they experience fever, chills, tiredness, or headache. These symptoms typically resolve within 1 to 2 days after receiving the vaccine. So during those days, try and take it easy. If you can, stay home. And just try and rest up so that way the vaccine will be fully effective. In closing, remember, if you're feeling sick, stay home. Continue to practice social distancing measures, practice routine hand washing, and if you have any other additional questions regarding the COVID-19 vaccine or your eligibility, feel free to reach out to your Injured Workers Pharmacy team or your healthcare provider with more questions. Thank you.